In my last two videos, we looked at two things. First, why an arthritic knee stays inflamed, why the biological fire, மூட்டுக்கு உள் எரிச்சல், the fire inside the joint, never completely goes out. Then, what stem cells actually do and what they don't. Today we connect them. Because to understand why a knee would ever need that kind of help, we have to ask the question both videos left open. The problem in osteoarthritis isn't simply that cartilage wears out, it's that the joint never seems to settle down. The biological fire never completely goes out. And one of the body's own protective cells, the maintenance engineer we met two videos ago, the macrophage, keeps receiving the same message over and over. Danger is still here. So, today the obvious question is, who keeps ringing the alarm? Why doesn't the knee realize the injury is over? Imagine a building catches fire. The alarm rings. The fire brigade arrives. The flames are extinguished. The damaged furniture is removed. The building is safe. Normally, the alarm is switched off. Everyone goes home. Now imagine something different. Every few minutes, the fire alarm starts ringing again. The fire brigade rushes back again, again, again. Soon, the building isn't being damaged by the original fire. It's being damaged by the endless emergency responses. That is remarkably similar to what happens in many arthritic knees. Every time damaged cartilage breaks down, tiny microscopic fragments are released. Think of them as tiny bits of biological debris. Every step, every twist, every episode of mechanical stress can release a few more of these microscopic fragments from an already damaged joint. You can't see them. An X-ray can't see them, but your immune system can.
But your immune system can. To the cells that keep watch inside the joint, these fragments look like fresh danger.
To the cells that keep watch inside the joint, these fragments look like fresh danger. Scientists call these fragments danger signals. They aren't germs, they are pieces of your own damaged tissue that tell the immune system that injury is still continuing. And the cell that keeps reacting to them isn't the stem cell we just talked about. It's the maintenance engineer from our inflammation video, the body's own guard, whose job is to protect the joint. Every new fragment presses the alarm button again, so it keeps behaving as though a new injury has just occurred. Not because the fragments are bacteria, not because they are viruses, but because they tell the immune system something is still being damaged. As long as those danger signals continue, the fire continues. Here is another important idea, and you may remember it from the inflammation video. The danger signals don't only come from damaged cartilage. Your whole body can add to the conversation. If you carry excess visceral fat, if you have a fatty liver, if your metabolism is unhealthy, your immune system is already on higher alert. Now imagine those whole body signals meeting the danger signals coming from the knee. The alarm becomes even louder. That's one reason why two people with the same X-ray can have completely different symptoms.
At first glance, these two knee X-rays appear completely identical. Both show mild joint space narrowing.
The biology is different. Patients often ask me, Doctor, why doesn't that cell simply stop listening? Because that isn't its job. Its job is to protect you if there is genuine danger. You want it to respond. The problem isn't the maintenance engineer. The problem is that it keeps receiving the wrong messages. It is doing exactly what it was designed to do. That changes everything. Because if the environment is keeping the alarm switched on, perhaps the answer isn't to fight the cell. Perhaps the answer is to change the environment. That is the whole idea behind PRASAD, The treatment I now use in this clinic, it doesn't try to silence your body's own cells. It works to change the environment that keeps the alarm ringing. There is one sentence I want you to remember from today's video. Healing is not only about mounting a response, healing is also about knowing when to end it. A healthy immune system knows both. It knows when to respond and it knows when to settle. Osteoarthritis isn't simply a disease of damaged cartilage. It is also a disease in which that second step becomes increasingly difficult. The joint struggles to switch from protection back to balance. So, next time someone tells you osteoarthritis is just wear and tear, remember something. Wear explains why the alarm rang. It doesn't explain why the alarm never stopped. மூட்டுக்கு உள் எரிச்சல் ஏன் அணையவில்லை? Why has the fire inside the joint not gone out? That is the biology we have to understand. Because only when we understand what is keeping the alarm alive, can we begin to think intelligently about treatment. Today, we have looked at the messages coming from inside the knee. But the knee isn't the only organ sending messages. In a next video, I'm going to show you how the rest of your body, especially your belly fat and your liver, can keep sending danger signals into the knee, even when your blood sugar is completely normal. What does the fat around your waist really have to do with your knee? The answer may change the way you think about arthritis forever. Thank you for watching. I am Dr. A.K. Venkatachalam. I will see you in the next video. Subscribe to my channel if you want to know why belly fat is a culprit for knee osteoarthritis.